Blood hypertension, causes and evidence-based dietary interventions. High blood pressure, or hypertension, is a chronic medical condition characterized by persistently elevated pressure in the arteries. It is often referred to as the silent killer because it typically has no symptoms but is a major risk factor for heart disease, stroke, kidney failure, and other serious health problems. Understanding its causes is the first step toward effective management, where dietary intervention plays a crucial and scientifically validated role. Part 1. The causes of high blood pressure. The causes of hypertension are classified into two main categories. 1. Primary essential hypertension. This accounts for approximately 90 to 95% of all cases. There is no single, identifiable cause for primary hypertension. Instead, it is understood to develop over time as a result of a complex interplay of genetic, environmental, and lifestyle factors. Key contributing factors: genetics and family history. A predisposition to hypertension can be inherited. Individuals with one or more close family members with the condition are at a higher risk. Age. The risk of developing high blood pressure increases with age as arteries naturally become stiffer and less elastic. High sodium intake. Excessive dietary sodium, salt, is a primary driver. It disrupts the body's fluid balance, causing it to retain water. This increases blood volume and, consequently, blood pressure. Low potassium intake. Potassium is essential for balancing sodium levels in the body. A diet lacking in potassium can lead to sodium accumulation, thereby raising blood pressure. Potassium also helps to ease tension in the blood vessel walls. Obesity and overweight. Excess body weight requires the heart to pump harder to supply blood to all tissues, which increases the force on the artery walls. Obesity is also linked to hormonal and metabolic changes that contribute to hypertension. Lack of physical activity. A sedentary lifestyle leads to a higher resting heart rate, meaning the heart must work harder with each contraction. Regular exercise strengthens the heart, allowing it to pump more blood with less effort. Excessive alcohol consumption. Drinking too much alcohol can raise blood pressure to unhealthy levels. Over time, heavy drinking can cause sustained hypertension. Chronic stress. High levels of stress can lead to temporary but frequent spikes in blood pressure. Associated behaviors, such as overeating, smoking, or drinking alcohol, also contribute to long-term high blood pressure. Import 2. Secondary hypertension. This type of hypertension accounts for 5 to 10% of cases and is caused by an underlying medical condition. It tends to appear suddenly and cause higher blood pressure than primary hypertension. Common underlying causes: chronic kidney disease, CKD, obstructive sleep apnea thyroid problems, hyperthyroidism or hypothyroidism, adrenal gland tumors, e.g., pheochromocytoma, congenital defects in blood vessels. Certain medications, including decongestants, some pain relievers, birth control pills, and illicit drugs like cocaine and amphetamines. Part 2. Managing high blood pressure with simple foods. Dietary modification is one of the most effective non-pharmacological strategies for lowering and controlling blood pressure. The approach focuses not just on single foods, but on a holistic dietary pattern, most famously represented by the DASH, Dietary Approaches to Stop Hypertension diet. The core principles involve reducing sodium while increasing the intake of key minerals like potassium, magnesium, and calcium, along with fiber and lean protein. Key dietary strategies and simple foods. Increase potassium intake to counteract sodium. Mechanism. Potassium encourages the kidneys to excrete more sodium through urine and helps relax blood vessel walls. Simple foods: leafy greens, spinach, kale, Swiss chard, fruits, bananas, avocados, oranges, apricots, vegetables, potatoes, sweet potatoes, tomatoes, legumes, beans, kidney, black, pinto, and lentils. Dairy, fat-free or low-fat yogurt and milk. 2. Boost intake of natural nitrates. Mechanism. Dietary nitrates are converted in the body to nitric oxide, a molecule that plays a critical role in vasodilation, the widening of blood vessels, which lowers blood pressure. Simple foods: beets, Beetroot and beet juice are exceptionally potent sources. Leafy greens. Arugula, rocket, lettuce, and spinach are also very high in nitrates. Garlic contains compounds like allicin that can stimulate nitric oxide production. 3. Incorporate magnesium and calcium mechanism. These minerals are vital for regulating blood pressure. Magnesium helps transport potassium and calcium across cell membranes and contributes to blood vessel relaxation. Calcium is important for the proper contraction and relaxation of the heart and blood vessels. Simple foods. Magnesium. Nuts, almonds, cashews, seeds, pumpkin, flax, legumes, whole grains, and dark chocolate. Calcium. Low-fat dairy products, yogurt, milk, fortified plant-based milks, canned salmon or sardines with bones, and leafy greens like kale. 4. Choose fiber-rich foods and whole grains. Mechanism. High-fiber diets are associated with lower blood pressure and improved heart health. Fiber aids in weight management and can help regulate blood sugar, both of which are beneficial for blood pressure control. Simple foods. Whole grains, oats, especially oatmeal, quinoa, brown rice, whole wheat bread. Oats contain a specific fiber called beta-glucan, which has been shown to lower blood pressure. Berries, blueberries, strawberries, and raspberries are rich in fiber and antioxidants called anthocyanins, which have been linked to lower blood pressure. Legumes and seeds, lentils, chickpeas, flax seeds, and chia seeds. 5. Opt for healthy fats. Mechanism. Omega-3 fatty acids have anti-inflammatory properties and are beneficial for overall cardiovascular health, which indirectly supports healthy blood pressure. Simple foods. Fatty fish, salmon, mackerel, herring, and sardines. Nuts and seeds, walnuts, and flax seeds. In the upcoming videos, important topics. So be sure to subscribe to the channel, share the video, and activate the bell to receive everything new. Thanks for watching.